Hello everyone and welcome to this Show Me tutorial on the accommodation reflex. Now, accommodation reflex is a reflex which is done when an object is coming closer to you, and this is basically your eye's mechanism to focus on the object better. And what happens is your eyes will deviate medially and your pupils will contract in order to focus on the object. And you might have seen this done as a part of a cranial nerve examination. Before we talk about the accommodation reflex, let's first talk about the anatomy of the eye. In this blue structure is something called the lens. Okay? The lens is our primary refractive medium, or our primary refractive structure. And refraction is a term used which is synonymous to sort of bending. Okay, so you want to bend the light image coming into the lens. Okay, so the lens is going to undergo refraction of the light or the image source, because what it wants to do ideally is when the light source comes in, it's going to want to bend it so that it focuses on this specific part of the retina called the fovea. Okay. And once again, a fovea is an area of the retina with the highest resolution, and retina is basically the area demarcated by orange. Now there are other structures in the eye. We also have these gray sort of stringy things, and these are the suspensory ligaments. And suspensory ligaments are attached to the ciliary body, which is controlled by this big chunky muscle, which is the ciliary muscle. Okay. Sorry for my bad handwriting. Okay, so now we've got the anatomy of the eye down, let's talk about how it actually works together to assist in the accommodation reflex. If you have an object far away, let's say here, okay, so you put your pen or your finger as far away from the patient as possible. What happens is that the light rays coming from the object travel so far that it basically becomes parallel by the time it hits the lens. This means that the lens doesn't need to refract that much in order for it to hit the back of the eye at the area fovea. Okay? However, if your object is closer, the light rays from a closer object diverges a bit more than the distant object, okay? And that's because it's closer to you. This will travel, and this means that your lens need to be a bit more round or concave in order for it to refract more and hit the back of the eye at the fovea. Okay? And once again, the fovea is the area of the highest resolution, and this is why we want the image source to hit there. Now, how does it actually go about doing this, and how does this information get conveyed into the accommodation reflex itself? Let's first talk about the visual pathway. Now, this diagram should be familiar to you guys all, but just to recap, what happens is as the object gets near to the patient, the image will be blurry, but the blurry image will still hit the back of the eye at the retina, and the visual information is going to get carried through the visual pathway, through the optic nerve, and the nasal hemiretinal information will decussate at the optic chiasma, where the temporal hemiretinal information will continue ipsilaterally, and they will eventually synapse at the lateral geniculate nucleus, which is here, and this is once again a nuclei of the thalamus. The visual information will be further carried by the optic radiation, and it's going to synapse at V1, which is our primary visual cortex. Now, it doesn't end there, unfortunately, and although this is a bit more extra information, what happens is there are white matter tracts that travel from the occipital lobe to the frontal lobe, and the visual information is going to get carried to an area of the frontal lobe called the frontal eye field, and this will in turn synapse at the oculomotor nerve nuclei. Okay, and these are the oculomotor nerve nuclei. And just to recap, there are two different types of oculomotor nerve nuclei. The first is demarcated by this red dot, and this is something called the Edinger-Westphal nucleus, and this is our parasympathetic nuclei of the oculomotor nerve, and the motor nuclei. Okay, and the fibers coming from the frontal eye field will synapse there. Now, by doing so, these two motor nuclei will send information to its respective structures. First, let's talk about what the motor nucleus does. Okay. Now remember that the oculomotor nerve supplies most of the extraocular muscle, but the most notable of which is the medial rectus muscle. And just to recap, medial rectus muscle is going to deviate the eye medially, this way. And this makes sense because patients who are undergoing the accommodation reflex will move their eyes medially. The parasympathetic information is going to then synapse at two muscles. First muscle is the ciliary muscle. Okay, and these are sort of the information coming from the ciliary ganglion, which are the postganglionic parasympathetic fibers. And what the ciliary muscle will do is it's going to, upon contraction, relax the suspensory ligaments. Okay, so by relaxing them, your lens becomes more fat, or it becomes more concave, and this allows greater angle of refraction to focus the light source at the fovea. What the PNS also does is it's going to supply a muscle called the sphincter pupillae. And the sphincter pupillae, as the name suggests, is a muscle that is responsible for constricting the pupils, like such. So, just to recap, the image, or the image source, hits the retina, and this is still a blurry image, but nonetheless it will go through the visual pathway, and it's going to get carried via the white matter tract into the frontal eye field, which will then synapse at the oculomotor nerve nuclei, which will then supply the extraocular muscles supplied by the oculomotor nerve, most notable of which is the medial rectus muscle, and this will deviate the eyes medially, and the parasympathetic component of the oculomotor nerve will supply the ciliary muscle from the ciliary ganglion, and it's going to lax the suspensory ligaments, and it's going to fatten out the lens or make the lens more concave, which will focus the image better for the fovea, and the sphincter pupillae is also going to get activated, which will constrict the pupils. Well, that's it, and feel free to drop me an email or a Facebook message or a Twitter feed. Make sure to use the hashtag NLM2Soton to stay with the discussion. Thank you very much.
Subscribe to Soton Brain Hub for more videos to help explain the mysteries of the brain.